maybe I could ask everybody in like 1 minute, just to summarize 1 or 2 thoughts on what supports you think can be made available from more centrally located, be it agencies or health systems themselves, towards local providers to support integrated care around the implementation of these models. Are there key roles? Are there key activities, key supports? I'll go backwards this time, Victoria, Camille, and ending up with Stephanie.
This idea of whether it's a policy entrepreneur or a knowledge broker or some such thing, but a role where that a person who actually knows how the system works, who the key stakeholders are, how we can approach those stakeholders, and also what the different levels, roles, and responsibilities are, and how to bring people together. I think that would be hugely helpful in implementation support, as an implementation support, to really take off the pressure from local implementers to actually go out and find out how the system actually works.
Yeah, I'd completely agree with that. I think from our findings and from our kind of experience of integrated care initiatives, where there's been transformational funding that has enabled kind of granular support, and I think kind of helping that kind of sharing of vision and that sharing of language has been really beneficial, and kind of building up kind of from the bottom up a shared kind of culture and vision, I think. But it really comes down to an individual or a group of individuals that kind of have that leadership in creating that space.
Okay, finally, Stephanie.
I also have to very much agree with Victoria and Camille that often a lot of what we do see and what people praise in all contexts is that capacity and that stability to have somebody who is, say, a contract manager who really knows what the intention of the policy is. Because often, and also previously in my experience, having been involved with some of the integrated care pilot evaluations, you'd often go to a field site and people would say, we've been given this legislation, we've been told to do it, we're opening the envelope, and we just are trying to do our very best to say, how do we do this legislation? So while there needs to be this room for this local adaptability, it's also really important to have that contract manager, that those dedicated funds for one person to really be able to sit down and figure out what does this look like in the best possible sense, so that they can very thoughtfully and coherently think about how to move forward with integration of care as this end goal, rather than just trying to do an exercise quite quickly to check a box, and to really achieve this meaningful integration between the sectors.
Can I just add in something quickly?
Yeah.
That's okay. I think something that's I'm seeing more and more in England is the use of potentially like independent or external advocates who kind of come in and help facilitate that discussion, and kind of really break things down into where are the barriers, who needs to be involved, how do we facilitate this conversation, how do we use our resources most efficiently. And I think kind of having that independence of someone coming in and creating that conversation and taking away some of the kind of previous cultural barriers has been quite beneficial. I mean, it's quite costly, but I think it's a worthy investment, I think, in the long term.
Yeah, that's actually what I was thinking of, is I know there's a similar project. There are these specialty project managers that get catapulted in. They've done it well one place, and they know where the areas and the barriers may be, and they're able to really draw people together. And that's such a costly but very helpful, very integral facilitator.
I think that facilitation role is quite key and important. We've learned of this right at the practice level in primary care teams, but also at this meso level. I was talking to some trainees a couple of weeks ago, and they asked about where the gaps were, and I said facilitation. We really need more people who are able to play these roles. I think, thank you so much for a lot of so much insight here.